Hi, this is Dan Praz. I am live from Underground Radio Network, and I'm here today to talk about part one of the healthcare law that was just passed. I am a CEO, and I actually read the entire law to see how it would affect my business. So I brought all the information I found from the law to my staff, and we had a staff meeting, and I explained what's going to happen and the changes with this law. And they were so first upset about it and thought it was so interesting. They said, I have to get this message out. And so therefore, we decided to do a series of videos to get this out to the public, to let you know what's really in it. You don't have to take my word for it. I'm going to quote exact passages. We're going to have the law up on the website for you to take a look at and compare the actual page numbers. Now, my business is a franchise business. The franchise industry is regulated by the federal government, by the FTC, the Federal Trade Commission. There are 2,500 franchise companies in America right now and doing about $1 trillion of business a year. So the FTC has an FTC rule for franchising, and that rule is 17 pages long. Now, 9 times in the rule, and I'll say this exactly as it is, 9 times in the rule, they mandate a franchise business like us to be clear, concise, and conspicuous. The 3 C's. Clear, concise, conspicuous. In fact, we must do this. And it actually says the law, and I'll read this to you. If we were to fail to do this, to fail to furnish any prospective franchisee with the following information accurately, clearly, concisely stated in a legible written document, they can shut my business down. I would not be allowed to be franchised any longer. And my document actually starts when we open the document. It actually says, this is presented to you in plain English. So I get the Patient Protection and Affordable Care Act, and I take a look at this thing. It's H.R. 3590, and it's 2,074 pages. Now, to regulate franchising, 17 pages. They're going to regulate healthcare with 2,074 pages. So the first thing I'm thinking is, what a ridiculous amount of pages. There has to be a scam. There has to be something in this that they're trying to keep you from reading, because otherwise, why put so many pages? Now, remember, Congress often passes laws that they exempt themselves from, that they make the citizens of the United States do, and what's really funny is they work for us. We don't work for them. So it's funny how they exempt themselves, but they mandate, well, me, for example, to be clear, concise, and conspicuous. So I'd like to read you just one sentence from H.R. 3590. And this is the law. This is the actual law that the president signed. This one particular sentence is 75 words long. Now, try to get a grasp of this, and I'll do my best. I really doubt I can do it in one breath, but I'll try. Premium adjustment percentage. For the purposes of paragraph 1BI and 2BI, the premium adjustment percentage for any calendar year is the percentage, if any, by which the average per capita premium for health insurance coverage in the United States for the preceding calendar year, as estimated by the Secretary no later than October 1st of such preceding calendar year, exceeds such average per capita premium for 2013 as determined by the Secretary. That's a quote right from the law. Did anybody get that? Did anybody understand what that really meant? The purpose of writing like this is to confuse you. The purpose of having a document that's more than 2,000 pages is so you won't attempt to read it, and therefore you won't know what's in it. But let me just go a little bit further. This sentence mentions this 1BI. Well, I searched the document, H.R. 3590, the law signed by the president. I searched one for 1BI. There are 14 pages in the table of contents. I couldn't find it. It's not listed. 1BI is not listed in the table of contents, so I searched the document. It appears 13 times. It is mentioned 13 times. This paragraph, 1BI, but it is nowhere to be found in the document. Then I tried to do 1B or BI to see if I can find that, and I couldn't find that either. It's confusing on purpose. The truth is, the law is basically a giant spending bill. It has 75 categories. And each category has its own separate spending measures. 75 different spending measures. Now, let me tell you straight up, I am not against health care for all Americans, not in any stretch of the imagination. I think if you're a Democrat, Republican, Independent, a moderate, conservative, or a liberal, I don't think you're going to find anybody who wants to deny health care to any American, and I believe that. But there's two simple questions that really haven't been answered. Not with this law, I can guarantee you that. The first is how to best, listen to the wording, best pay for that. The second is how to best manage it. So for all of you, this is what I really don't understand. There's a lot of support for this. And it really baffles me, and I have to tell you, I cannot believe that anybody would think that the government is the best way to go, either for doing the payment part of this or the management part. And just let me tell you why. This exact plan was modeled after Massachusetts, who in 2006 it was enacted that they were going to have full coverage for all their citizens. They estimated somewhere around $88 million a year to do this. It was so wrong. It's $880 million. And they're actually going bankrupt. Massachusetts is going bankrupt in order to give the people who live there, the citizens of Massachusetts, health care. You know, we're told that this is because poor people use the emergency room for their health care needs, and that once they have insurance, rooms will clear out. That's not true. Emergency room use from 2006 is up in Massachusetts 17.5%. Up. Now, how about government to the rescue for money? In 1965, the CBO, the Congressional Budget Office, it's the same characters who did the estimate what this particular bill would cost. Well, they said Medicare in 1990 would cost $12 billion. $12 billion. It really cost $107 billion. You know, the bottom line is, again, nothing against giving everybody health care. But there's no free lunch. There's no such thing. Somebody has to pay for it. Now, the truth is, last year, the United States had a deficit. That means we didn't have enough money. A deficit of $1.4 trillion. This year, we're going to have a deficit of $1.4 trillion. We owe China, Russia, Brazil, Hong Kong, and 30 other countries $4 trillion. We're broke. We haven't had a balanced budget in the modern era. The federal government is the worst possible entity to manage and figure out how to pay for health care. Period. And nobody can argue with me on that. You can't. It's a simple fact. Now, if you want to learn more, we're going to have 2 more series. The next part is what the healthcare is really all about, and part 3 is going to be all the hidden things that are in it. So please watch the other videos and visit our site. It's debtorsrebellion.com. Come on the site. I have a People's Bill of Rights that I want you to read and see if you agree with. Thanks a lot.